Hello, everyone. It's Dr. Nicole Rochester, founder and CEO of Your GPS Doc. I am here with our final Patient Safety Awareness Week tip. I hope that you have been watching the tips all week. We talked about medication safety. We talked about the importance of asking questions. We talked about having an appointment buddy, and we talked about hand hygiene and hand washing. And in this final tip, I want to introduce you to my system that I use for my clients, that I share with my friends and family members for navigating the healthcare system and keeping you and your loved ones safe. And that system is the GPS system for navigating healthcare. Now, of course, it's the GPS system, right? Because I am the GPS doctor. So I want to go through this with you. It is very important, you all, to be active in your medical journey. I cannot stress that enough. You are not meant to be a backseat driver. This is not a passive process. Maybe it worked in the past, but I'm telling you that no longer works. And the reason it no longer works is because our healthcare system has gotten more and more complicated. In addition to the fact that it's more and more complicated, it has gotten less and less patient centered. I don't care what you see on the banners in the front of the hospitals. I don't care what is shown on those glossy, brochures and pamphlets that you're given when you go to the doctor's office. Generally, our healthcare system is not patient centered. It's not family centered. It is about money. Healthcare is a business. Now, the people working in healthcare are mostly there for the right reasons. And so I don't want you to be discouraged about that. However, we are working in a system that is flawed. And because of that, you have to play an active role in your medical care in order to get the appropriate care and in order to stay safe. Okay? So let's talk about my GPS system. The G is to gather information. It is so important that you become knowledgeable about your health conditions. If you are a family caregiver, it is important that you become knowledgeable about the conditions that your family member or loved one has, okay? So the way that you do that is asking questions. And we did a whole nother Patient Safety Awareness Week video about the importance of asking questions. So if you missed that, just scroll back through and watch that video. But asking questions is one of the ways that you gather information so that you are knowledgeable about your medical history, about your medications, about the procedures that you've had, about the doctors that are on your medical team. This is incredibly important so that when you are receiving medical care, you can be that source of information and you can confidently and accurately give an account of your medical information. This allows you to be an active participant on your team and to engage in dialogue, okay? So gather information means asking questions. Maybe there's some information that you can request from your doctor. Maybe you can ask about a reputable website where you can get additional information after that visit. Maybe there is a brochure or some other written information that you can read about. But I want you to be a sponge when it comes to your medical care, when it comes to your chronic illnesses, when it comes to any new diagnosis that you receive. I want you to practice the G in the GPS system, which is to gather information. The P is to position yourself as an expert. What happens is that when you gather that information, you will realize that you are the expert. Now, we have MD or DO after our name, or you may have nurse practitioners or physician assistants or other specialists on your team, and they are all wonderful. But no one, hear me, no one is the expert on your body. No one is the expert on how you feel, how you react to medications. No one is the expert on that other than you. If you are a family caregiver, you know that you have intimate knowledge of that family member, of that friend, of that neighbor. You are the one that's going to see that early sign that something is wrong, despite the fact that the test or the x-ray or the other studies may look normal. You know when something's wrong with you. And if you're a family caregiver, you know when something is wrong with your loved one. So you have to walk in that expertise and you have to position yourself as an expert. That means knowing the intimate details of your medical history, and then that means displaying that when you are engaging in dialogue, okay? Extremely important. Engage in a dialogue with your healthcare professionals. Let them know that you want to be intimately involved. Let them know that you are a decision maker. Let them know that you know and you understand your health conditions and you are showing up as an equal partner. All right? And then the S in the GPS system is to speak up for yourself. If you are a caregiver, speak up for your loved one. This is probably the most important element of the GPS system. I have shared with you all on numerous videos that you receive better care when you speak up for yourself, when you are a strong advocate for yourself. Those of you that have been following me for a while, you know that I and my two sisters cared for our late father, and that is the whole reason that I left my career in pediatrics and started Your GPS Doc. But what I discovered during my caregiving journey is that my voice and my ability to advocate for my dad made a difference. My dad got better medical care when my sisters and when I spoke up on his behalf. And we could only do that by practicing those first two, by gathering information and by positioning ourselves as experts. And then we were able to speak up for our dad. What does speaking up mean? That means that if someone is, sharing information about you or your health history that's inaccurate, you don't sit back and go, oh, I don't want to say anything because I don't want to offend them. No, you speak up and say, I'm sorry, that's incorrect. And you correct that misinformation. Speaking up also means that you have an active voice and you play an active role in decision making. You don't just let things happen to you. You make sure that things are happening for you, so that when the doctors and the other members of your medical team are making recommendations, speaking up may mean saying, that doesn't quite align with my values, or I have concerns about that, or I don't understand. Would you mind saying that a little more slowly? Would you mind writing that down for me? Would you mind putting that in lay terms? That is all part of speaking up and advocating for yourself. And sometimes speaking up may mean escalating concerns. If you are in a situation where the person in front of you is not giving you the information that you need, they're not talking with you in a way that is conducive to you understanding, you don't feel that they have your best interests at heart for whatever reason, you have the right and the power to escalate your concerns. Everybody has a boss, okay? There is always another layer. There is always someone else that you can speak to voice your concerns. So I want to encourage you to do that, okay? I'm not telling you to be cantankerous. I'm not telling you to be, adversarial. I'm not telling you to be rude, but I am telling you that your ability and your willingness and your confidence to speak up on your behalf, to correct misinformation, to escalate your concerns is going to be incredibly important as you and your loved ones travel throughout this complicated healthcare system. All right, so let's just briefly go through those again. This is my GPS system for navigating healthcare, for keeping yourself safe. G is to gather information. P is to position yourself as the expert. And the S is to speak up, advocate for yourself and for your loved ones. I hope that you all have enjoyed these tips. Please share this video. Please like and subscribe to my YouTube channel. And be sure to come back for episodes of Navigator Nuggets. I hope that you're following me on social media, on Facebook, Instagram, and Twitter. Just search Your GPS Doc. You all, it has been a pleasure bringing you these Patient Safety Awareness Week tips, and I will see you again very, very soon. All right, take care.